Welcome back. This is our last lecture together. How exciting. I just wanted to say to everyone that I am so proud of you. I'm so proud of the work that you've done. Mental health is really, really hard to, I think, to understand because it's not as concrete as other disease processes. So congratulations, and I'm so happy that I had time to spend with all of you, and I hope that you also enjoyed the class. So for our last lecture, we are going to be talking about vulnerable populations, and really we have been talking about vulnerable populations all along. But if we want to define exactly what vulnerable means, is it means susceptibility to actual or potential stressors that may lead to adverse effects. So a vulnerable population is a group of people who have an increased risk for developing adverse health outcomes. And those risks, again, can be related to environment, social aspects, personal behaviors, or biological factors. So all people have different social and environmental resources. They all have different skills. They all have different support systems, and they all have different accesses to health care. So really vulnerability occurs when these resources are decreased. So vulnerable populations often share similar limited resources, such as physical or environmental. It may be working or living conditions, personal resources. It might be poverty or a limited social network. Biologic, physiologic, and social resources can be limited, such as illness or genetic predisposition or limited family support again. So vulnerability can be reversed by obtaining resources or increasing resiliency. And what we have on this slide is just a depiction of how the poverty cycle can affect generations. It has been determined that decreased income and limited education contribute highly to increased risk or being a vulnerable population. So typically the poor and uneducated people live in unsafe living environments. They work in stressful environments. They live and eat unhealthily. They are sometimes uninsured, although that has, has been not such an issue since Obamacare was initiated. And they participate in risky behaviors such as smoking or substance abuse. So poverty can become generational. And what this means is that children who live in a vulnerable environment learn those living conditions, and they tend to carry it on. So if you look at a family who lives in poverty, they have a child, and that child grows up in that poverty situation. They are significantly disadvantaged in relation to education and skills. Therefore, the child grows up and has difficulty getting a job, and they are unable to get out of that poverty cycle, and it starts all over again. That person is living in poverty, has limited skills and resources, and they have children, and so on and so forth. So this is called generational poverty. And what occurs when a person lives in this cycle as a child, they develop this external locus of control, which means that they believe events that occur to them are outside of their control, and they therefore have difficulty taking action to correct any of those things. It just becomes normal for them. So there is a book that I read by Ruby Payne that I would suggest, if you like to read, that you read it. And one story in that book that she tells that had a huge impact on me to understand this generational poverty. So the story goes is that a nurse is working with a family, and she's in the home environment, and she is assessing the situation. So this family has very limited resources. They don't even have a refrigerator to keep their food in. So they're eating foods that are come in boxes, and we know that that is very unhealthy, a lot of starch and fats and whatnot. No fresh foods whatsoever because they have nowhere to keep it. So as she's working with this family, some family member dies, right? And this family happens to get a small sum of money, like a few $1,000s. So she's thinking, the nurse is thinking, well, now they can go get that refrigerator so that they can have some fresh food and a place to put milk and stuff for the children. So when she comes back to visit the family, no refrigerator. Nothing's really changed. The environment is the same. So she says to the parents, well, what did you do with the money that you got in the inheritance? And the parents say they took a vacation somewhere. So this just reinforces that when you grow up in this cycle, your thought process isn't on how you can improve your situation. It's really about entertainment and pleasure. So oftentimes people will get really frustrated because, say, you have a family that's on welfare and food stamps and medical assistance, and they don't work, but they have money to buy cigarettes or get tattoos, things of that nature. It's very frustrating, but really, if you get down to the nitty-gritty, it's the learned process. It's the learned external locus of control. So this really has an effect on how nurses can influence these people, because these people are not going to be very I don't know, cooperative is the word, but they're not going to be motivated to make the changes that you want them to make to promote their health and well-being, because they don't believe that they can change anything. So it creates a real challenge for the nurse to try and advocate change for these family members. So why is it important to identify vulnerable populations? And I'm just going to show you this quick little video here so that you can understand what we as nurses can do for this population. So vulnerability increases mortality, morbidity, chronic disease, and communicable disease. So really the role of the nurse is to be a case manager, to be a case finder, to be an educator, to be a care coordinator, a policy maker, an advocate, a counselor, and a direct care provider for these populations. I was hoping this was going to start. This always happens to me. Very, very slow. So the next slide you can see is regarding Healthy People 2020, and you can see what the goals are of Healthy People 2020. And really, you know, we're looking at populations that are vulnerable, such as mental health, environmentally challenged, physically challenged. And here we go. We're going to watch this video.
I'm a pediatrician by training, and I got to see a lot of the challenges that vulnerable populations face, but also the challenges that the system faced in terms of trying to operate efficiently. Vulnerable populations, meaning low-income people, people without insurance, and people in racial and ethnic minority groups, really have greater problems getting access to health care and also have poor health outcomes when they do in the healthcare system as a whole. At the Commonwealth Fund, we focus on better ways that the health and well-being of these populations themselves, but also to bring down costs in the healthcare system as a whole. At the Commonwealth Fund, we focus on better ways that hospitals and doctors can work together to really improve care for vulnerable populations. The other area that we really need to focus on is improving the way we deliver care. Hospitals, clinics sometimes need to bring access to them, so they've embedded themselves in community sites, either they went through home visits, homeless shelters, schools, in which people can get care more seamlessly without having major disruptions in their access to care. There's a lot of opportunity under the health reform law that could improve very useful in improving health care. Medicaid expansion would really help, not just
Okay, we're not going to do this video. It's
in
just
terms
too
of
choppy.
providing coverage.
I think you kind of got the feeling for what I was trying to reach. So we need to, as nurses, one of the things I wanted you to get out of that video was that we need to take the care to the vulnerable populations. And like she said, either the home visits or community drives or homeless shelters and such, is where we need to go find the vulnerable populations and help them in their environment. Okay? So Healthy People 2020, here are some of their goals. And really every county performs what we call a community needs assessment. So this is where they assess the resources within their community to see if we are meeting the needs of the population and these vulnerable populations. So if you have this PowerPoint in slideshow and you click on that little book called report, you can actually see the report that was created for Marathon County. And it's very, very interesting, but it tries to identify the strengths and the resources within Marathon County. And some of the strengths that they identified was the educational system, the strong healthcare system, strong business, the family community orientation of the communities, and the abundance of natural resources. Now, some weaknesses that they identified were poverty. 4.3% of the population is living in poverty. Unemployment, 6.6% of the people are unemployed. Alcohol and drug abuse is on the rise. Mental health resources are limited, and community resources are limited. There's been a 4% increase in homelessness. There are 8% of the elderly living in poverty, excuse me. Things like that. So you can take a look at some of that information, but it's really astounding to me what really is going on. And I think for those who don't deal with these issues, don't realize the extent of the problems in our own neighborhoods. So something else that I wanted to just talk to you about is that many of the benefits that people are eligible for, such as food stamps and medical assistance and dependent care supplements or home rent, like home assistance or energy assistance, are all based on what they call the poverty line. Okay, and the government, specifically the Census Bureau, determines what this poverty level is. And for instance, this example, for a family of four for 2015, the poverty level is 24, somewhere around 24,000. Therefore, you would need to make less than 24,000 to even qualify for many of these programs that are out there. So that in itself is a barrier that we need to think about for these populations. So predisposing factors to being vulnerable. Mental illness, definitely. I mean, you can imagine these people, their mental illness affects their ability to function in society. Many of our mentally ill patients cannot hold a job because of their mental illness. And so they are a vulnerable population. Chronic health problems, substance abuse, all of these factors listed on the slide contribute to a group being vulnerable. So groups of special concern are going to be your poor and your homeless. Age, if you're elderly or you're a child, those people are vulnerable personalities, vulnerable populations. The disabled, the mentally ill, pregnant women, migrant workers, veterans. So vulnerability is defined by race, ethnicity, socioeconomic status, geography, gender, age, or disability status. Now, what I wanted to say is race and ethnicity are not the cause of vulnerability in itself, but they are barriers because of the way the people live. So, if we talk about migrant workers, for instance, often these people have a very low income. They are migratory status. They may have language and cultural barriers. They may live in poor temporary housing that's substandard or overcrowded or has poor sanitation or drinking water. They may be isolated because of their cultural ethnic barriers. They may fear deportation. They are living in poverty. They have limited education. All of these factors contribute to migrant workers being a vulnerable population, but not because or singly because of their race or ethnicity. I hope that makes sense to you. So, as far as poverty, I already mentioned the Department of Health and Human Services and the Census Bureau sets that poverty limit for benefits. So people who are poor are often living in hazardous situations, overcrowding, again, inadequate sanitation, working at high-risk jobs, eating poorly, have multiple stressors. And so they're going to have poor health outcomes. The homeless. 26% of the homeless have a mental health disease. I thought that was astounding. The highest incidence of homelessness is related to substance abuse. So these people are going to have poor hygiene, maybe hypothermia or hyperthermia from living in the elements, parasites, communicable diseases, substance abuse, dental problems, mental illness. Lots and lots of things that need to be addressed. And then one last group I just wanted to mention was rural. Okay, you may not think these people are vulnerable, but they are. And the reason is because they have limited health resources. There is a known shortage of healthcare providers in rural communities. And actually there has been a big push by the government to pay for healthcare providers' education with the promise that these healthcare providers will then practice in these rural communities because the need is so great. So the initiative is to train and secure healthcare providers in the rural populations. Residents in rural populations are at higher risk for being low income, for having decreased education, lacking access to health care, and there is an increased unintentional injury from farm equipment or possibly guns. These people may have transportation difficulties in getting into the cities, things like that. So that makes the population vulnerable. So again, these are our barriers that as nurses we are going to have to deal with when we are trying to work with the vulnerable population. Their priorities might not be the same as ours. Their motivation may not be the same as ours. Previous experiences, if they've had bad previous experiences, they're going to be skeptical and not trust us as healthcare professionals. They lack knowledge. They lack the education to even understand the knowledge we're going to provide for them. Some of these people may be illiterate. So we have to teach in different modes than just giving them a brochure of written material. Okay. Cultural factors, as we discussed, poverty and accessibility. These are all barriers to healthcare for vulnerable populations. So what is our role, again, as community health nurses? We're going to be case finders. We need to find these people and address these issues. We need to establish trust with them, again, because they are going to be mistrustful. We need to identify needs in the community. Are we meeting the vulnerable population's needs or not? Or where do we need to improve? We're going to be providing referrals throughout the healthcare system and to the social system in that, social services to help these people get benefits that they may qualify for. We're going to be collaborating and advocating, counseling individuals, educating them, and doing case management or evaluating and follow up on our efforts. And there was one thing I wanted to mention, and it just flew out of my mind. Oh, yes. So when we are collaborating and making referrals, we as the nurse need to know what community resources out there and what qualifying factors are part of those resources. And what I mean by that is, so if we're going to refer somebody to social services to get food stamps or medical assistance, um, we need to know what it takes to qualify for food stamps, because the worst thing that we can do is send a family who is already stressed to a facility and have the facility tell them you don't qualify and turn them away. That is the worst thing that we can do to an already stressed and discouraged client. So as a collaborative advocate and referral maker, we do not want to do harm. So we are going to make sure that we're sending them that they are going to get the help that we say they're going to get. Okay? So healthcare needs of these populations, obviously safety, nutrition, attending to injuries, trying to help with those chronic disease management strategies, doing preventative care, and maintenance of chronic long-term. So if I can use an example, let's use the homeless. So primary prevention, we're going to be working to improve their living conditions. We're going to be reducing exposure to communicable disease. We're going to be enhancing efforts to improve hygiene or eliminate parasites such as lice or scabies. Making sure that they have the immunizations. A secondary kind of prevention we're going to be doing is screening and referring for acute or chronic healthcare conditions. And then tertiary level, we're going to be trying to manage their chronic health problems and their physical problems. Okay. So this is just resources for you. Again, remember, we need to be knowledgeable on community resources that are available in our local community. So if we're looking at Marathon County, you might want to look at what's available at the health department. You might want to look at what's available through the American Red Cross. What kind of volunteer organizations do you have in your community? What kind of food or clothing banks do we have, such as Salvation Army or St. Vincent's? Are there any missions or churches that offer assistance to these populations? Again, social services, can they offer any financial assistance? How about, are there any free clinics where these individuals could get health care at a free or a reduced cost? The Aging and Disability Resource Center often will have resources for the elderly population. United Way is another good resource. The Neighbor's Place, and again, Salvation Army. These are just a name, a few of the resources that are out there in this local community. So explore those and find out what your community has to offer. And this is our last lecture. So again, congratulations, and I'll see you in class.